Hello, world and universe. Welcome to the Trevor Donald Experience. Manifest your truth. And if you're new to the channel, please hit that like and subscribe button. And for all my continued followers, I want to say thank you. And this is an opinion-based video channel where I try to open your eyes and ears to some of the travails and trepidations that take place throughout our cities, our states, our country, and sometimes around the world. And this is a very interesting story and troubling story that's straight out of Ohio by a female plastic surgeon who was videotaping her surgeries on TikTok. And they called her Dr. Roxy. Her name is Dr. Katharine Roxanne Grawe. So here we go. And she got in trouble with the state board and lost her medical license. Here we go. Dr. Katharine Roxanne Grawe, a.k.a. Dr. Roxy, disfigured 14 women, lawsuit says. An Ohio TikTok surgeon whose medical license was suspended earlier this month wounded or disfigured at least 14 women, including a cancer survivor who was left with a hole in her chest after breast surgery, lawsuit claims. Dr. Katharine Roxanne Grawe, who went by the name Dr. Roxy and frequently live streamed her surgeries on TikTok, lost her medical license after the Ohio State Medical Board found she violated standard procedures. Dr. Grawe is now facing lawsuits from at least 14 women over the past decade for allegedly botching their surgeries, according to Franklin and Delaware County database in Ohio. One of the victims, Mary Jenkins, a cancer survivor who was left with a gaping hole in her chest after breast reconstruction in 2012, said it nearly killed her. The surgery literally almost killed me, so I sued her in 2016 and won my case, Jenkins said in a TikTok video she posted on Thursday. She appealed and lost her appeal. From the very beginning, my desire was for her not to hurt anyone else. When asked how she felt about Grawe's medical license being revoked, Jenkins said she has a sense of peace and relief. Jenkins confronted the former doctor after her license was revoked on July 12th because she wanted to be the first person she saw when she left the hearing. Dr. Grawe can be seen glancing up to say hi to Mary before quickly walking away from trailing reporters in a video she shared on TikTok. In 2012, I went to Dr. Roxanne Grawe to have a tram flap with tummy tuck for breast reconstruction post stage 3, almost stage 4 breast cancer, she captioned in the video. She, in my opinion, tried to kill me, but I survived, she added. In 2014, I sued her. In 2016, the jury found her guilty of malpractice and medical negligence. What I wanted was for her license to be permanently suspended. Well, finally, on July 12, 2023, the Ohio Medical Board permanently revoked her license so she couldn't disfigure and or mutilate another person. For 11 years, while still working to raise money to help cancer patients in need of paying their bills, I hoped it would happen, and it finally did. Dr. Grawe was barred from practicing medicine for live streaming operations, which included a botched liposuction that caused a perforated bowel. Despite her efforts to regain her license, officials at the Ohio State Medical Board ruled to permanently revoke it earlier this month. Dr. Grawe had accumulated thousands of social media followers as Dr. Roxy, and clients even came to her after they were impressed by her TikToks. Dr. Grawe claimed she always asked for permission, but the state medical board said it was inappropriate to share that footage and that the procedure should have had her full attention. Her surgical procedure should have had her full attention. Speaking to the board, ABC6 reported that she said, Dr. Grawe, I ask you from the bottom of my heart to please consider my thoughts with an open mind. This has humbled me more than you can know. I am willing to change my social media practices, and I will never live stream a surgery again. In response, a medical board member replied, "We've seen an extreme lack of professionalism." Her post done as a marketing ploy in the video for patient want for her post done as a marketing ploy. In the video, you can see her looking at the camera and not paying attention to the patient. According to the Federation of State Medical Boards, FSMB, states actively share information related to practitioners who have been disciplined. The Physician Data Center, PDC, collects and maintains all actions taken against physicians which could hamper any work she wishes to do outside of the state. The FSMB, which is the Federation of State Medical Boards, says that states are notified within 24 hours should a license who has been sanctioned by another state appear in their territory, with the notified board free to initiate its own actions. The state medical board warned her in 2021 that it was wrong to live stream her operations. The state board had already warned her in 2021. She was urged to undertake remedial education courses related to plastic surgery, complications, professionalism, and ethics. She was asked to provide certificates of completion of the courses, along with summaries about what she learned and how she would apply it to her future practice. Yet, Dr. Grawe continued to live stream the operations, the state medical board said. In November 2022, the board revoked her license, citing clear and convincing evidence that her continued practice presented a danger of immediate and serious harm to the public. In one case cited by the state medical board, a patient was sent to the emergency room by a nurse practitioner at Roxy Plastic Surgery less than a week after receiving liposuction, a Brazilian butt lift, and a skin tightening procedure from Dr. Grawe. Free air was found in her abdomen, and medical staff discovered that she was suffering from hepatic encephalopathy, which is the loss of brain function when a damaged liver fails to remove toxins from the blood. Surgeons found her bowel had been perforated, and she had a serious bacterial infection. The patient required a prolonged stay with multiple procedures to remove dead tissue, plus an open abdomen and skin grafting, according to Dr. Grawe's notice of suspension. At least part of her procedure at Dr. Grawe's office, was live streamed on social media again, according to the board. The board said Dr. Grawe was looking and speaking to the camera while performing liposuction on the patient's abdomen and was evidently distracted from the surgery. Some of Grawe's patients admitted they were lured in by the social media content she had shared. Kelsey Gardinas told ABC6 she chose Dr. Grawe for her July 22 breast augmentation after watching the TikToks. Cardenas said, "As a woman, we already know how we pick ourselves apart about stuff. So to think that it's that easy to go into her office and she can fix everything that is wrong with you." After agreeing to have her operation shared on social media, it was a disaster and left her with huge scars that would not heal. Cardenas continued, "They kept telling me it would be better in 2 weeks. It will be better in 2 weeks. But it took 25 weeks. It was still not until December that it was fully closed and I didn't have some sort of scab." She said she is now traumatized by the footage of her operation and consulted other doctors who said they were appalled by Dr. Grawe's work. She said, "I went to the wound center. The doctor there was appalled. He said this is never going to look normal again without reconstructive surgery." What an incredible case. This young lady, Dr. Grawe, went through all of this schooling, grade school, high school, college, medical school, residency training. She had to be at the top of her class to get accepted to medical school, to do a residency in plastic surgery, which is very difficult to get accepted to and to finish. Normally, they take 1 or 2 medical students for residency in plastic surgery per hospital. It is very hard to become a plastic surgeon, an open heart surgeon, a neurosurgeon, an ophthalmologist, orthopedist. Those are very, very difficult specialties to get accepted to. So you have to be at the top of your class. So intellectually, evidently, Dr. Grawe or Dr. Roxy was a very bright book student, but she got an A in the books, but she was getting an F in common sense. This social media thing has a lot of power. And not only has it been influencing young people, which it is designed and marketed to, but we have older folks in their 40s, 50s, and 60s that are utilizing and are getting addicted to these social media platforms like you would not believe. This young lady went into a profession of healing and helping, and then she turned it into some kind of distracted marketing ploy. And I guess she believed that she was some kind of famous TikTok doctor. And of course, if you garner enough followers and enough likes, you can monetize TikTok. But what was the point of that? The average plastic surgeon makes $600,000 to $1 million a year on average. It is a very highly specialized skill, and you are working on human beings, putting them completely asleep, doing reconstruction. You're almost like a construction worker or rehabbing a house, but you're rehabbing a human being. The difference is for a doctor to do reconstructive surgery on a human being, and if it doesn't go right, it can lead to death or permanent disfiguration. Whereas in a house, you mess up, you replace some bricks, some plaster, and everything is fine and nobody dies. I think Dr. Roxy got confused and her fame overtook her professionalism and what it meant to be a well-trained, highly skilled plastic surgeon. And I think she got lost in the sauce, and fame somehow, her becoming famous on TikTok overtook her desire to be the best plastic surgeon in the state of Ohio or in America. She let social media completely distract her, and as a result of all those years of training, all those years of sacrifice, all those years of supposed to be in a profession of helping and healing, she ended up getting distracted as a result of being famous on TikTok as Dr. Roxy and filming her surgeries, actually filming her surgeries, talking to the camera, being completely distracted while somebody is completely sedated and is having reconstructive surgery done on them. She ended up disfiguring at least 14 individuals. You would have thought that after she made a mistake with one, that she would have turned that camera off and stopped using TikTok as a marketing platform for when she was garnering patients or doing surgery. There's also, even though she had some of these patients filling out consent forms for her to live stream their surgeries, there are all kind of HIPAA violations and HIPAA laws that Dr. Roxy was potentially violating. All kind of HIPAA laws that she was potentially violating. She was teetering on the brink of losing her license or getting her license suspended from day one of filming her live surgeries. It's one thing to film an interview or a pre-surgery consult or a post-surgery consult or filming your office and its dynamics, but to actual film your surgery like it's a football game or a basketball game, in that genre, people can make mistakes. You can have a turnover. It's not life and death. But as a doctor, as a plastic surgeon, to have somebody fully asleep and you're reconstructing their body, you need your full attention and detail on the work that you're doing on that human being. I don't know if Dr. Roxy just got lost in the sauce of this TikTok fame, or she was having some kind of delusional, narcissistic, utopian view of herself where she could do multiple things at once while she's doing surgery on a real live human being. But this has complete her fame from TikTok and social media platforms has completely backfired on her. And for those who don't know, it generally takes after high school, you got 4 years of college, 4 years of medical school, that's 8 years. And to do plastic surgery, you're talking another 4 to 5 years, 1 to 2 years doing general surgery, and a 3 to 4 year period of doing plastic surgery specialty in your residency. So she gave up 12 years after high school, at least, to become a board certified plastic surgeon, and to give it and throw it all away over a social media platform or platforms makes not an ounce of sense. So, just because you've seen in many of my other videos, I've talked about judges and lawyers and teachers, police officers, police chiefs, doctors who have garnered a high level of community and civic professionalism and respect, and then for some reason, something clicks in these individuals' brains, and they start losing their spatial relationship with reality. And I think this is what exactly happened to Dr. Roxy. It is unfortunate. She will never be able to practice medicine again, and we have to definitely pray for the 14 women that she allegedly disfigured. Their lives will be traumatized and different forever when you talk about post PTSD as a result of what Dr. Roxy has allegedly done to these individuals. There are some doctors out here and lawyers who have garnered licenses and who started out trying to do the right thing, and then for some reason they get distracted or other things take over in their lives, and they end up doing heinous, diabolical things to other human beings. We are losing our spatial relationship between life and death. It is a minuscule speck, and we are losing our humanity and our humanness each and every day with some of these crazy stories that I give you. As I say, I'm just trying to open your eyes and ears up to some of the things that are taking place throughout our country that you may not be aware of with our busy lives. And this is an unfortunate scenario where Dr. Katharine Roxanne Grawe, board certified plastic surgeon out of Ohio, ended up disfiguring over 14 women by being distracted by filming her surgeries, reconstructive surgeries, on social media platforms like TikTok. It's not TikTok's fault, it's Dr. Roxy's fault. And she was committing harm, which is the odd dichotomy, because she went into a profession to help people and she ended up harming multiple individuals. And I think the state of Ohio did the right thing by they gave her several warnings, and then they ended up suspending and revoking her license. She didn't get the message the first time or the signal, and as a result, we can't let these physicians and surgeons out here who have the potential to commit harmful and heinous crimes or situations to vulnerable patients. The medical boards, our state government agencies have to protect our American citizens by any means necessary, and this is an unfortunate story. This has been a Trevor Donald Experience. Manifest your truth.